Good morning. I am tired. Tired is past tired, but I am tired. But I am here. You guys, did you miss me? I'm just gonna sit here and wait for some of you ladies to come through. What's up? What's up? What's up? Come through. Yes, I have been just laid back, low, been kind of little low occupancy, basically decompressing and studying. You guys, good morning, Alicia Renee. Good morning. Miss Tammy is tired today. But you guys, I definitely wanted to get in. I wanted to talk to you guys about a very hot topic that's going around, and want to talk about how does that affect the plastic surgery industry. And we want to talk today about fentanyl. We're talking about fentanyl, you guys. Yes, that is our hot topic for today. And so what I want to talk about, for one thing, is, it has been, rumored and is known that, Miami Port is a high trafficking port. 9 times out of 10 under the port, they're finding all kinds of things. But right now, in the last couple of months, there has been a high discovery of fentanyl trying to move in. Okay, high traffic of fentanyl. So what we want to say is, how is that affecting the plastic surgery community? Okay, so what if you guys have not noticed that there is a lot of doctors that are now prescribing things like yeah, Alicia, I see RN, MSN, you talked about the no face and stuff like that. But you guys are there, some of the surgeons are now prescribing things like tramadol, Tylenol 3, things of that nature. What we are discovering is, too, that a lot of the surgeons are not credentialed to write narcotic scripts. You are seeing a lot of the pharmacists at Seduction where they are now filling your script totally, and they are filling it with tramadol as far as a pain medicine they are giving. We are finding that a lot of the doctors, some of the doctors' MPI is not matching again with their name. And so what is this cause? Is it's caused a fear factor in women that's coming down here. And oh my God, am I going to be able to get pain medicine? Am I going to have pain medicine? And it's forcing them to look for street drugs. Okay, so here goes the puzzle. How does it fit? Okay, street drugs is it Slim, inbox me. How does it fit? So now with the overwhelming attention to the plastic surgery industry, with women more and more seeking out to have the procedure and the fear factors around it, we are going to see that we are finding that, and this is some things that people are not telling you. They are not telling you about the near deaths and the death experiences with these street drugs. You have people overdosing on marijuana because it's got fentanyl in it. Okay. So now we are still on the hunt. If you guys haven't paid attention to Cat Williams' World War III live comedy on Netflix, he said something that was so profound. He said, we ain't the drug dealers anymore. It's the doctors. You know, so ladies, be real careful with the need to want to buy street drugs, because you guys are still having overwhelming fear of not being able to get the medication. You want to go to a doctor, but you know that this doctor at this point maybe is not credentialed to write narcotic scripts, or maybe his preference is not to write narcotic scripts. I don't know all of the factors surrounding why we are seeing, you know, a lot of doctors at Mia Aesthetics is prescribing ibuprofen, Motrin. They're just simply writing the script for it. We also are seeing where there's a real big issue with a lot of the NPIs that are going on. One of the things is doing. Okay, Alicia. I don't know really what that is. I know that there are more requirements coming down. We do know that Bulos now is doing the 3D imaging with his procedures, which is now somewhat of a requirement that we are using some kind of ultrasonic device so that we know where we're going to. So I'm going to say kudos out to Bulos. Bulos has always been my number one, you know. It is also confirming that he is staying within the specs. So those ladies who are having Bulos for your surgical procedure, really check into the requirements and your dates. Ladies, you definitely want to make sure that you guys are seeing that these doctors are converting to a safer practice. We looked into, you guys remember, I think the last time you guys seen me, I was on live with nurse practitioner Tony, and we were talking about the drug. I think that that's Benny. I think that you are right. There, once your pain is managed, I mean, okay, yeah, I am seeing that as well. Once we can manage your pain, I think the first 24 hours, you do need some strong pain medicine to get, especially after the anesthesia wears off. I think within 24 hours, your pain should be managed, and you could just as well manage with a non-narcotic drug. But for you to be comfortable and get to the other side of this thing, I think that, you know, a couple of doses, you know, within that 6 to 8 hour time frame would suffice you. I think a lot of the pain is through the fear, and it's also that mental setup that we are doing to each other in these groups by one girl just expressing her low tolerance pain, and she goes in there and makes it seem like it's the most excruciating thing that you're ever going to feel in your entire life. Not to say that you're not going to be in pain. Okay, so let's talk about pain. You know, and this is one of the reasons why a lot of you girls are going to the pain shot. If in fact, as Nurse Tony had suggested that you guys do, as I suggest all the time, no matter what it is that I say, do your research, okay? I need you guys to do your research. Anybody research the drug? Okay? Did anybody research the drug? Give me 1 second. Just want to go to my notes. Did anybody research the drug? You guys remember what the drug name was? The drug that you guys are paying all this money for after surgery. I just want to see if anybody remember. Don't jump and believe everything. Anybody remember what the name of that drug was that they're giving you, that they're charging you $1,000 for? Anybody remember the drug? What's the drug name? Not tramadol. Mm-mm. It wasn't tramadol, you guys. It started with an E. Yes. Who's that? Who's that? Who's that? Who's that? Alicia. But yeah, that spelling really got us really messed up. But as we know, Tony did put the spelling in the chat for you guys. So let's talk about that drug. What we found out as he and I did go through and really research, and he really having some systems that he can really pull up more in depth, being a nurse practitioner and really being able to get into the system and stuff. It is actually a nerve blocker, you guys. It's a nerve blocker, and it's given by an anesthesiologist. One of the things that you guys have to be very careful about, and it ranges in price, and is subject to them being able to put their own price, and we know that it ranged for as low as $200 and on up. So and that's all in the discretion of the person that's administering this form of a nerve blocker. It can potentially cause nerve damage. Okay. Also, is it worth it to get this thing where we understand that you will experience overwhelming sense of nausea, some dizziness. Yes, people think that they have the euphoria of, okay, my pain is lessened because my nerves have been blocked. I know. So, looking at the potential side effects of the drug, of what you're paying for. Some people are saying, okay, I did fine, but later started wondering why they had an overwhelming sense of numbness, legs falling asleep, hands falling asleep. They just laying there and they have to work their hands and fingers out because there could be a nerve delay. So what risk are we having, especially when we're doing things like this, that we might have immediate results, but what is the longevity effects that it could have? So enough to know that the surgery already has its risk, and the risks are also not seen always right away. We find that some women develop seroma, some other forms of issues that happen. So when we're starting to add more things to the equation, and that's why my saying was always, what would you do for a Klondike bar? Okay. Yes, that's exactly right. Soothe. That's Benny. That's exactly right. And it does definitely depends. But we're talking about this procedure where you already stated yourself that, if you could just do some extra strength, it blocks your nerves. Exactly. It blocks the pain from your nerves, but does it take it away? I think at that moment, like you said, for that period of time. But if we allow our bodies to go through the process, and that's why we always talk about not masking symptoms. Like I say, please keep your bags light. We have lock boxes. We allow you to lock up, and give you the key and lock up your medication and stuff. We will open it with you, and making sure that the dosage and stuff is correct, because if there's things that we need to see, we need not over mask them. Okay. And that's what we're doing when we start putting things like nerve blockers and things like that. We are masking things that possibly should be seen. If in fact my body can't respond to the pain to a point where my pain will allow you to indicate that I might have an infection. But if it's numbed and blocked, it's not going to respond. So you're not going to know to way much later that I might be experiencing an infection from the surgery, but I'm numb. The pain, I'm blocked. My nerves is blocked. So all of that ain't there. So I might appear to be good, but it's all false, It's all false. So at the end of the day, we have to be mindful of the lengths of that we're willing to go to, and not say, hey, and then those that do well, because they think they're doing well, they don't know how well they're doing, because your body's been falsely numbed. Your nerves have been blocked, but what else would that cause? What else would that block? What else would that hide? You guys feel me? Like, we might solve one situation, but we might be creating danger in other situations because my body's not able to respond and have those indicators that we need. Sometimes, painful to the touch, is a sign that maybe that area is infected or whatever. But if I can't feel it because I'm numb, you won't know till it wear off or later on. And so again, you guys don't always look for I'm going to plug my phone or something. Look for instant gratification that may have a longevity effect on you. I'm not saying don't, you guys, I'm just here to get information. I am not here to sway your opinion or tell you not to. I just want to, and I've always said that I just want to give you guys options. I want to give you information so you make a better option. But whatever you choose, Miss Tammy gonna roll with it, right? But so never once do you think that it's to persuade anything. But if you don't have enough information, how do you know you're making a conscious decision? If somebody's only giving you part of the story, if they're only giving you part of it, so again, that is everything that I've always wanted to do, is make sure that you guys stay well informed, not to bash or whatever. It's to give you guys that just another way of looking at things, another side to the story. Sometimes people create, because marketing, as I tell you, I can see marketing gadgets and techniques that could be a terminal situation for some people, and so when I'm talking from that perspective. Oh, okay. Yeah. Thanks for following up on that. Well, the young lady, the hemo was still low. Her doctor decided to put her on some other medications out. However, she was at I think it was a 9 something. And at that point, Tony did not, based on her surgery date, getting her an infusion, even though it would have brought her up at least 2 to 3 points, wasn't going to be enough for her to be where they wanted her to be, in order to get surgery. So she still would not have made it. And then the days that it taken anywhere between 3 to 7 days, as you remember Tony said. So she didn't have enough time at that point. So what she did discuss is that she would do an infusion and then keep taking what the doctor told her to take. And a lot of times people don't tell everything, because at the end of the day, she did admit that she did have iron issues, that she probably should have been taking some infusions way before that. But again, she went to just like the regular, SS tonic and things like that. And I think that this, again, is information that, guys, that we need to use But it's still 5 months away. Okay, yeah. So she'll be fine. They just get your hemo up now. Okay, so we got a question out there off the subject. And this was something else, though, I was going to talk about that you guys do need to start looking out for. And one of the reasons is not just the fact that they want you to bring cash to the clinics, is for untraceable money, but I've been talked about that. I told somebody the next time they call you and shit, put them on the phone and tell them it's the IRS. They want to know where the hell this cash coming from. It's because seduction, and a lot of them are getting sued on their refund policies, and people trying to reverse their charges, and we know seduction has really lied their ass off. I had an indication with seduction even went to the point of saying that they had did the surgery when they had not, because I had got the girl at a different surgery clinic who Dr. Magic Mike did do her surgery, and they sent back to the bank trying to get the money back, and actually lied and said that they, however they did perform the surgery, being the fact that now this young lady had to get a lawyer because it's no longer he say she say. They need to subpoena the documentation to prove that you in fact did it, the surgery. And again, they have been calling all kind of lies. But you're gonna see a lot of clinics is going to go to trying to get more cash because they can secure the bag. That means that you can't go and call Cash App. You can't, what I'm saying? No, but again, you're right. The more that clinic is pushing cash, I think the Better Business Bureau, the IRS, and everybody needs to know what kind of business practices are happening there, so that they can look into it. If a lot of people begin to report it, then they will look into it. This is scam. Him and his daughter, yeah. Every dog has his day, though. Right now, they gonna have their day in court. Yep, that daughter and all of them. Yeah. So again, I shoot, they make you pay a lot, but seduction been doing that for a minute. Seduction. It's a force to reckon with to a certain extent, whereas they was the leading pack in a lot of the behaviors that you are seeing in the clinics now. Yes, Miriam. Hey, Miriam. Welcome. So again, you guys, just to recap, you guys be very, very careful with this fentanyl and things that's out here, because people are prone to want to go out here and get these edibles. People are ODing on weed. People aren't getting the pain medication from their private care physicians at home. So they know that they might have a doctor that's only prescribing tramadol or ibuprofen or things of that such. So they're going to the streets to try and buy pain medicine. Guys, be careful. There has been some issues related to that. There has been a few girls that have gotten down here and have ran out of pain medicine and have sought to try and buy some on the street. And in Miami, I wouldn't buy nothing, no street, nothing in Miami. The port had found so much illegal fentanyl trying to get in. But so imagine how much that they found, how much already done made it. Yeah, just the other day, if you guys read up on it, that OD on marijuana. People ODing on marijuana now. Oh my God, watch your CBD. Oh my God, So that's why I say if you don't know what's in them damn drips, tips, and this and that, man, please, you getting a cut on this, a cut on that. We just gotta cut it the fuck out. We gotta cut it out. We gotta know where we going, who we going to, what's in it, Man, like, we really gotta look at all angles of this shit. Because everybody, you remember Miss Tammy told y'all way back, like, everybody want to get in this shit. When you have a market that's getting ready, like everybody wanted to get in on crypto, and everybody wanted to get in on Bitcoin, everybody want to get in on plastic surgery, even the dope man. He was like, yo, let me put a cut on this. Yeah, let them girls know, when you got comedians using plastic surgery in their material, then you know which way it's going. When you got it in rap songs and stuff, then that's already a clear indication that this thing has now landed. It has made a mark in society. It has now been awareness that this is happening, right? And so with that happening, everybody is watching now. How do we get into it? How do we get a nickel, a dollar out of that? I told somebody, I said, what the hell is Amazon got a motherfucker running around here marketing? Because every time you turn around, some shit we done thought of Amazon, we done put it together and got it on Amazon. Like, they got Amazon representatives running around here doing surveys and shit. Like, Amazon ain't missing a damn beat. Yeah, the Levinox shots is a blood thinner. It's supposed to keep your blood from clotting, especially when you're on the plane. All right, Soothe Benny. She own it today. All right, Leisha, somebody about to get your damn job. She like poop, 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 poop with them answers. Keep up the good work. Thank you. Important, yes, it is important. I do suggest a minimum, of 3. If you're gonna take them. 3, 1 after surgery. I see you. 1 after surgery, 1 the night before you leave, and 1 2 hours prior to boarding the plane. But they be giving you like a box of 10. They be giving you a big ass box. I'm gonna take one every day. No, because I've seen one girl taking them every day, plus getting massages and stuff. They had given her a box. I had told her how I had felt, that I thought that was too many. She's not going to Africa or anywhere. She don't really need that many shots. And with that thinning her blood, and with that, she started to have massages and stuff. And what it did, because her blood's being thin and she's taking them every day, and you're pushing out fluids, and she's going to get massages and all of this here, it actually promoted low hemo in her, because of the blood flow and the things like that. So it could, too many could be damaging. So don't, Leisha, don't be promoting Vixen shit on my damn live. Don't be promoting Vixen. You know how I feel. How's the girl in Mexico? Okay, so yeah, the girl in Mexico. I think the last time I talked to, I got a call, to tell you the truth, you guys, that, she was in some pain. She got a few things did. She did look good on the outside. surface. But I didn't hear anything else. Oh, okay, now, yeah, now if you want to promote it like that, but don't be promoting it like it's the thing to do. Um, is what's watch out for Goofy, Dumb and Dumber. But so I have not heard anything yet. I will call. I did offer her to call me before she left, but I was getting information on it through my girlfriend that referred her to come to me in the first place, and so that's where I was getting a lot of the information from. But being that they are in Cali, they are like, I think, 3 hours window, and you know, and then she works and stuff like that. So I will find out for you guys. But hopefully everything's good. Maybe no news. Hopefully no news is good news. Okay, but I'll follow up for you guys. Thanks for asking, because I did let them know that a lot of you guys have been out there praying for her. Yeah, out there praying for her. Y'all got curse words all over my screen. It's called TRIGGS. That is a cuss word. Leisha, we don't put that up on my screen. Delete. Thank you, ma'am. Lisa just left. So soon. I thought you was a girl. Now you gonna do it too? Now, yeah, Lisa, you did. Hot mess. Y'all already know how I feel. Thank you, Lisa. That's what we'll say. Lisa, you both y'all in the doghouse. You and Sue. Y'all in the doghouse with me. Ducking them in with the just saying. All right, Tootie. But you ladies is crazy. So all right, we're gonna change the channel. Okay. So again, guys, let's go ahead and just really be careful with that. You guys really have your friends and those that are considering taking the shot for pain and paying all that money and wonder if it's going to be worth it, and to really understand the effects that could happen, longevity. I don't think that they really explain to you, you know, what it is, but it is a nerve blocker. And some women are not getting as great results from it. But again, we are taking a level of risk when we are taking it, you know. And it's similar to an epidural, you know. We're paying okay, but one of the things is that I did ask that you guys understand that there could be some effects to it. It also could mask things that need to be masked as far as your recovery process, because your body's not going to be able to respond to it by letting us know that you're in some excruciating pain. And that could indicate that there may be signs of infection and other things going on. But if it's blocked, it's blocked. Y'all know what I'm about to do? I'm about to close this live down, because y'all look like y'all got a conversation going on that y'all need to inbox each other. I'm doing my live. That's my driver just came up. Hey, Miss Tamer, how do you feel about J-Flame? Huh? Yeah, I gotta go and see what's going on. All right. I had a young lady that called me yesterday about it. I thought that some people were not going to be doing it at all, but I did have J plasma. I did have inner thigh J plasma with Dr. Valina, and as she indicated too, it's about 6 months before you definitely see the effects of it. J plasma is not something that you kind of feel that you had something different because it's like a little numbing itself, but the overall look, it will take some time to kind of see that, and I think that's why, a lot of people have been, pulled away from it. How do I like Dr. Valina? I don't know who Dr. Valina is anymore versus who I met before with, and she was new and she came out, and her and Dr. Bulos, I felt like was, awesome tag team. Dr. Bulos decided to get away from the shenanigans. I'm not sure how she's been infected and not affected, but infected by it. I have not, I don't at this point see a lot of Valina dolls lately. But I do have a couple people that will be going, and I'll let you know. He was around. So we'll see that, because our life's experiences and things that we go through and the people that we surround ourselves around can infect us to a point that we are no longer operating the same anymore, based on our platform, our culture, and all those things that add up, that continues to change the authenticity of ourselves because of people pleasing, just trying to be a part of the pack, going for this and going for that. So I think that I can observe some shifts in no ma'am what some shifts in some of these doctors, and we don't want it to be money being the root of all evil. However, I just need to really look into Dr. Valina, and I will have an opportunity to see her. But I was a fan. I guess I could say I am a fan, but I can't verify right now. Ginger Brown said, Mama preach. So, seeing is believing, and being consistent. I don't believe in what hit wondership. You hit it out the park today. Well, when you go back to the same park, let me see you hit that same, So yeah. Well, anyway, you guys, I got a lot of early morning surgeries. I know. I know. I think it's, you know what? It's not even so necessary that I'm not a fan of a lot of the doctors. I'm not a fan of the process that's here in Miami anymore, or all the shit that you guys got to go through with that front line. Who was it that's now trying to take that front line out the picture? I can't remember who it is, but you guys, I think it's that, yeah, it's the extortion, and it's this, that, because, I've had a lot of girls test, and one of the girls said, Miss Tammy, I test what you said. I went back there and I told the doctor this, and that, and the doctor didn't know what the hell I was talking about. I said, all that, they done seen the doctor, they done went and talked to the doctor, all of that shit, everything, a lot of them doctors don't know. Dr. Williams is probably one of the ones that's down with all the okie doke in the front and the motherfucking back. He on some ooey OG. He on social media clouting type stuff, so he involved in all of that. So 9 times out of 10, when y'all dealing with that over there, he got his hands in it. He know everything about it. he driving the damn car. Yes, go, y'all, get in. Oh, speaking of that, the other day I went up there to pick up somebody. I had went through. They was doing a video at Seduction. The man was in the car. I know who the fuck was that in the car. They were doing, I got to see, they were doing a video. But the security guard know me, and he was like, Miss Tammy, come on. I know you coming in. They wasn't letting people in. But I was glad that they was like, let's listen. Because she might just pull out a damn camera and start filming. It was so funny because they was like, well, why they let you in? And I just like, shit, they let me in, get my patient, and let's go. Because I'm not going to be sitting there waiting for y'all to do no goddamn video. You're not going to hold me up. And who the fuck is in that car with that goddamn wig? So when I got in, everybody just stared and looked and shit. I was like, yeah, I'm just, listen, I ain't even gonna look at this. Just as long as this here bullshit don't hold me up, I ain't got nothing to do with what y'all doing, but this some bullshit. Y'all got time to be out here making videos and shit, and you can't even answer a return motherfucker phone call, but y'all got the whole parking lot blocked off so y'all can make old bullshit ass video. That's the type of shit they was on. But you ain't gonna hold me up. I'm sorry, excuse me. I will be all in the video. All in the video. I gotta wait to see it. I don't even know what the content of the video was, but I would have been all in it if, you know, me talking shit, getting my girls and this and that. I don't know. They was like, cut. You too. You be blessed too. All right, guys. But anyway, it's getting ready to get hot. Gotta go. As you always know. Am I my sister's keeper? Yes, I am. And always remember, this isn't for the weak, and this isn't for the cheap. All right, love. Talk to you guys later. I'm out.